All right. It looks like we are live, so I'm going to go ahead and get started. Thank you all, panelists and viewers, for being here with us today. Just a couple of things I want to note before we kick off. This is the first Lunch and Learn that we're doing as the Center for Pharmacy Practice Innovation. And it's a series of Facebook Lives we're going to be doing to share pharmacist expertise on relevant aspects of just living a healthy lifestyle. We obviously decided to start with the COVID vaccine because it is one of the most relevant things to us right now. But this is our first time, so if there's a few glitches, please just bear with us. We're doing our best to answer your questions and share everything with you as soon as possible. So before we jump in, I just want to emphasize we've gathered these panelists here today. They're about to introduce themselves to inform the general public about the COVID vaccine. I think I probably speak for all of us when I say that we recommend that most people get the vaccine, but today we are focused on sharing facts so you can make the most informed decision possible. So without further ado, I'm going to turn it over to our panelists. If you'll just go across the board and introduce yourselves, that would be great. Dr. Van Tassel, why don't you start for us?
Hi, my name is Ben Van Tassel. I'm a pharmacist and faculty member at the VCU School of Pharmacy and have had the chance to be involved in some of our early efforts to get our healthcare workers vaccinated here at the medical center.
And I'm Dr. Kristen Zimmerman. I am also a pharmacist. I practice in a geriatric primary care practice, and I teach at the School of Pharmacy.
Great, thank you. Dr. Roman, could you go next for us?
Hi, my name is Yusuf Roman. I'm an assistant professor at the School of Pharmacy at Virginia Commonwealth University. I'm a pharmacist and I'm engaged in geriatrics as well as minority health research. And I'm also interested in genomics. So glad to be with you.
Thank you. Dr. Gravitt?
Hi, my name is Dr. Gravitt, and I am a clinical pharmacist in internal medicine at VCU Health System, and I'm also a professor at the VCU School of Pharmacy, where I teach infectious disease, which includes COVID and vaccines. So.
Wonderful, thank you. And Dr. Harrison, would you close us out with introductions?
Sure. My name is Dr. Michelle Harrison. I'm Assistant Director of Pharmacy for the Department of Pharmacy Services for VCU Health, and I currently serve as the Director of Pharmacy for our joint venture, Sheltering Arms Institute.
Wonderful. Thank you all again for being with us today. I'm just going to kick it off with our first question. So personally and collectively, I think I'm hearing a lot about this vaccine being different from others with the mRNA technology and it being need to be stored in deep freezers. Dr. Van Tassel, could you describe to us what is new and interesting about this COVID vaccine?
Sure, I think there's a lot that we've learned about this vaccine in the past few months. And I would say just as we're kicking things off, one of the best resources that I found is actually the New England Journal of Medicine has set up a frequently asked questions page devoted to these vaccines. So if we don't get to all the questions today, I think that's a great resource for the public to go and look up. But just in short, the idea with these mRNA vaccines is that instead of injecting folks with portions of a virus or a live attenuated virus like we've tried in the past, what we're doing with this vaccine is we're actually injecting the messenger RNA, or kind of the code, to produce some of the proteins that are involved in this virus. So what's actually in the vaccine is this code so that your body can make some of these viral proteins without ever being exposed to the entire virus itself. And by getting your body to produce a lot of these proteins, it allows the immune system to see them, to recognize them, and to prepare to see these proteins if and when they're actually exposed to the virus in the future. So it's a great way of inducing immunity without incurring a significant amount of risk. And the body seems to do really well with this approach. And the immunization, the success rate of these immunes is as good as we've seen in any vaccine that we've used in the past.
That's great. That's great. So there's a few different vaccines from different companies. Could you tell us a little more about the differences between those?
Sure. The two vaccines that we're using so far, one comes from Pfizer and one comes from Moderna. In terms of their benefit, they really do seem to be, for the most part, interchangeable. The biggest difference between them is that both shots require a 2-dose sequence. The Pfizer vaccine requires a 21-day window between the first and the second dose, whereas the Moderna vaccine requires a 28-day window between the two vaccines. So the Moderna sequence takes a little bit longer to complete, but the immunization efficacy that you get from them seems to be pretty similar. From a logistical standpoint, there is a difference in terms of the storage requirements that you may have heard about. The intense ultra freezing that you need to keep these vaccines stable is primarily an issue with the Pfizer vaccine. So the Pfizer vaccine has to be in one of these deep -70 degrees freezers up until you take it out. Whereas the Moderna vaccine just needs to be in a traditional freezer and is actually stable even in a fridge for multiple weeks. So in terms of transportation and shipping, the Moderna vaccine is a little bit easier.
Do people have a choice between which one they get? Does it matter, I guess?
That's a great question. I don't know that we have an answer to that. I think that the vaccines that we get are the vaccines that we use. So I'm not aware of exactly how things are going to be rolled out in the coming weeks and months. Right now, what we've been doing locally at our vaccine clinics is we use the vaccines that we have. Some days we have been using the Pfizer vaccine, some days we've been using the Moderna ones. I do think it's important to, when you get that vaccine, you'll get a little vaccine card, and make sure you keep track of that so you know that if you get dose 1 of the Pfizer sequence, you're going to want to make sure you get dose 2 of the Pfizer sequence. There's a pretty good chance that it may not make a lot of difference if you switch from one to the other, but we don't want to encourage that. We want to make sure that whatever vaccine you get the first time, make sure you get that the second one.
Definitely. Thank you for sharing that. I guess a good follow-up to that is, why are there 2 doses? And is it actually necessary for people to get both?
This is a great question and an important one that we try to reiterate with everybody that sits down to get a vaccine. So with these vaccines, within about a week of receiving the first vaccine, regardless of which one you get, we see about a 50% reduction in your risk of COVID-19. So both of them, even with that first dose, again, 7 to 10 days later, you are going to see a meaningful benefit. However, 50% benefit is really not what we're looking for here. We're really looking to help folks to achieve immunity. So if you really want to get up to that complete immunity level, which means you're 95% protected from getting a serious infection, that's what that second dose does for you. So that's why we really want to make sure people come back for that second dose and let people know that, up until you get that second dose, and in honesty, it's about a week after you get that second dose, you're still going to be vulnerable to infection. So that's why it's so important to come back and get that second dose. You really get the maximum benefit from this vaccine.
Absolutely. And I apologize if you already said this, but you've received your vaccine already, correct?
I did. I was fortunate enough to get it with some of the first round of vaccines that we were doing with our healthcare workers. And so I completed my second dose a week ago, so I'm now fully immunized.
That's great. Thank you for sharing. Dr. Zimmerman, I'm going to switch over to you. Who among the public should be prioritizing taking the vaccine right now, and why?
Yeah, so it's a great question, and not new news that we know older adults have been disproportionately impacted by this virus in general. While they represent a relatively small portion of our overall total population, they're comprising nearly half of all cases and almost 80% of all deaths related to COVID-19. And we know that this increase in negative outcomes for older adults is really linear with age. The fatality rate for adults under the age of 55 is less than 1%. But as you move into age groups, such as those who are over 65 through about 84, you climb up to just over 10%. As you near 85 years of age and older, you near 30%. So we're really seeing that this is a high risk group for negative outcomes, and that they're comprising a lot of cases. And there's a lot of factors that explain this, potentially, weakened immune systems with age, increased rates and, progression of different types of chronic diseases that are associated with sort of poorer outcomes. So things like cardiovascular disease, diabetes, respiratory diseases, and kidney diseases. So because of this, older adults really should be and are recommended to be prioritized for the vaccine. And the great news is that we've seen, lower rates of adverse reactions, but equivalent or similar immune responses and immune protection for the 2 currently available vaccines and for those vaccines that are coming up in the pipeline. So that's pretty fabulous. And on a personal note, I also want to drop a consideration for pregnant women to, consider getting the vaccine, considering the likelihood of developing respiratory complications, particularly needing a ventilator, needing ICU care, increased risk of severe illness and death compared to non-pregnant women, risk for preterm birth, for example. So while the overall case rate is low in women in that age group, the sort of risk for negative outcomes if you were to contract COVID-19 is really quite high. So if someone is a healthcare worker at high risk or a frontline worker at high risk, it might be worth the added consideration to consider getting the vaccine. So current recommendations do emphasize that pregnant women should be considered for the vaccine upon discussion with their provider. So as a healthcare worker well into her 2nd trimester, I was thrilled to receive my vaccine.
Great, and congratulations. I don't think I knew you were pregnant, so congrats. Including kind of lumping onto that, does that include women who are breastfeeding as well? Would you recommend they get it?
Yeah, so it's interesting with women who are breastfeeding, we're not seeing the same risks for negative outcomes as a result of simply lactating. But we do see that pregnant and lactating women were largely excluded from the original trials, though women did become pregnant or women were lactating who did ultimately receive the vaccine. And there's no reason to believe that it would be unsafe. So certainly if someone is a lactating woman who's in a high risk environment, such as a healthcare frontline worker, I would absolutely consider, prioritizing that individual for the vaccine. And thank you for the congrats.
You're welcome. What about children? I've seen that I think one of the vaccines was tested on kids who are 16 to 18. What would you recommend or consider there?
Ooh, you're asking the wrong person for children. The age group that I largely serve are older adults who are very complex and have lots of multimorbidity. So I think perhaps Dr. Gravitt and Dr. Van Tassel would probably have better data on children.
Great. Would one of you all chime in for me?
Sure, I'm happy to jump in. Right now, we just don't have testing recommendations for kids. So the Pfizer vaccine was approved for children down to the age of 16. The Moderna vaccine is only 18 years and up. So we're kind of in a stay tuned pattern in terms of when those vaccines will be rolled out and available for kids.
And just one thing to note, specifically the Pfizer vaccine, the original trial was set for individuals 12 and up. And so they have been enrolling those patients from 12 to 15. And actually, I just found out last week, they just ended that particular trial. So I think we're going to get a lot more information about that 12 to 15 group very soon.
That's good to know. Thank you all for sharing. Dr. Zeman, one last question for you. For the older individuals watching, where can they go that you know of to get the vaccine the fastest?
So this has been an ever evolving situation and an area of confusion for many. So I am thrilled that we have Dr. Harrison on here to sort of, I think, close us out a little bit later on today. When it comes to older adults, up until this point, only about 5% of older Virginians over the age of 60 have been vaccinated. And just yesterday, the governor modified the next priority group, 1B, to include not just the originally intended adults over the age of 75, but also anyone over 65, among some other tweaks to that priority group. And so 1B will open up on Monday. So if older adults are living in long-term care facilities, for example, they should be in the 1A priority group and obtain the vaccine or have already hopefully obtained the vaccine through contracts that their facility has. So for individuals who might be living in the community in that older adult age group, Dr. Harrison, I'm sure will tell us more, but the VDH, Virginia Department of Health, currently recommends receiving the vaccine through your healthcare provider. And this might be most efficient for providers that are affiliated with large healthcare systems or networks. So our geriatric primary care clinic, for example, will be starting vaccine clinics up next week. The VDH and local health departments are also encouraging folks to connect online and to submit an interest form, which will provide more information on upcoming mass vaccination events that are planned to start as soon as next week. Sort of I guess, foreshadowing of speakers to come. The issue kind of that I see with that, and it will be a good segue into Dr. Rahman's, area of expertise, is that this might present some barriers for older adults who might not be tech savvy, have access to technology, or have a certain level of tech literacy and access. So.
Sure. Thank you for sharing that. Dr. Roman, switching over to you, how can we achieve health equity, do you think, in vaccination programs?
Great, thank you so much. This is a great question, and it's on everybody's mind. How can we get everybody to get the vaccine, which really what we really are all about, because we can't get back to normal with people being vaccinated and some are not vaccinated. So to really create a health equity in vaccination program, I think there are consensus on 3 elements. One is creating or providing vaccination where people are, helping people to receive the vaccine where they are, and you don't necessarily have to impose new level of complexity to come to a clinic or to commute or to do an extra layer of work to get to a site where they get the vaccine. So that's a very important element in terms of helping and facilitating this process. The second point is the ability to improve health communication. I think it's important as we start to thinking about some of the information that come online or on social media, people can develop concerns and they develop worrisome about, am I gonna get the vaccine? I'm worried about the vaccine. So I think we need to build health communication that grounded on facts, grounded on truth, and grounded on basically science. That's how we're gonna earn the trust. That's how we're gonna build the trust so people can be engaged in taking the vaccine and trusting the vaccine that they're taking. And the third element is actually taking a step backward a little bit, which actually go back into a little bit my area where how can we get to the point from the very beginning to develop effective vaccine, which involves engaging minorities, engaging people of racial backgrounds that are not necessarily the predominant population. So I think to get to the point when we have effective vaccine, we need to think about getting people into trials and getting people to be involved in research. That way we can develop effective treatment for everybody and not only for a subset of patients.
Absolutely. And to your knowledge, there were a large portion of minority groups in the vaccine trials. Is that correct?
Yes, absolutely. These trials involved in the thousands and thousands. So clearly, the sample size of these studies clearly really give us the confidence that we didn't only study a fraction of people, and I think thanks to the NIH and obviously others who deliberately encourage people to participate, also engaging community to encourage people of minority and different backgrounds to be involved in research, that really helped us to be able to achieve some of what we consider to be predefined sample size to get us enough people in the studies so that we're confident about the results. Yeah.
Great, thank you. So COVID-19 hospitalizations and mortality rates, they do appear to be higher in certain racial groups. What would you say are some of the determinants leading to such health disparities?
That's a great question, and I'm sure everybody, if you didn't see that, probably I'm surprised because we know that this is COVID-19 really uncovered an existing issue, an existing problem in our society, which is health disparity. But I'll take a little bit of a kind of step back, and I want to just say that everybody can get the vaccine. So clearly we can get infected. It doesn't matter what your race, what your job, what your gender, whatever, everybody can get infected. But the issue is going from an infection to basically requiring hospitalization. And unfortunately from hospitalization to mortality, we see a bifurcation in terms of racial background. So we start to see people of Hispanic and obviously African-American, they're almost 2 to 3 times higher, developing basically, obviously, mortality rates as well as hospitalization. And to kind of digest this a little further, so what really leads to that disparity is the fact that we're seeing the comorbidities that increase your risk for infection tend to be also much higher in these minority populations. So we know clearly onsets of diabetes, chronic kidney disease, hypertension tend to disproportionately affect subpopulation. And unfortunately, this subpopulation, when they are infected with the virus, they quickly and obviously more likely to progress to hospitalization and unfortunately, basically death. But one thing that also, because I'm interested in genomics and we also learned a little bit about the fact that there's some genetic component to the worsening or progression from infection to hospitalization. While genetic matters, your zip code matters too. And what I mean by that, where do you live? What's your access to resources, healthcare? So these are also another layer that definitely can lead to the disparity of basically COVID mortality and obviously COVID hospitalization. So while the genetic code is critical, and I'm biased toward that, but your zip code is also important. So I just want to say that as well.
Absolutely, absolutely. So there are a lot of rumors floating around about this vaccine and with how quickly it was rolled out and what's in it. Are you able to explain some of those myths for us around the COVID vaccine?
Sure, absolutely. I will definitely, I will tell one for sure, because that's the one I got the most, because it's, my genetic background stuff. Basically, does your vaccine change your DNA? So I'll do that. I'll do my best job as much as possible, but I will do a little bit of background on biology so that way we understand what happens. So think about your biology 101, high school level biology. Central dogma. You start with your DNA. Your DNA gets transcribed to develop the RNA or the messenger RNA, and your messenger RNA becomes your protein. That's the sequence of events. As Dr. Van Tassel mentioned, this vaccine takes that middleman, think about it, the middleman, that between the DNA to the protein, and take that code and inject it into your body to basically tell your body what to do. So basically you're injecting the code through a syringe, simply. But what really unique about that is this particular code or this injection, once it gets taken into the cell, it does not cross the nucleus, where basically your DNA or your blueprint lives. So that's the good news, because obviously if it gets to the nucleus, then it becomes susceptible to be integrated into your DNA, which may lead to definitely this alteration of DNA. But the reality is this vaccine does not cross the nucleus. Hence, it does not have any effect, no effect whatsoever on altering your DNA. So that's something I want to just thank you for the question, and also want to assure the public that this vaccine does not alter your DNA. It does not do anything to your DNA.
That's a great explanation. Thank you for breaking that down for us.
Sure,
And I believe this has already been stated, but if you could just clarify for us, you can't get COVID from this vaccine, correct?
Absolutely not. That does not cause you to have COVID. This is not a virus. This is really, I would call them RNA sequence, basically wrapped up in a liposome, basically like a fat layer to basically get into the cell and to be taken by the cell.
Wonderful, thank you. And you've received your vaccine as well, correct?
Actually, no, I will have to admit, I haven't done, but I will on the 18th. So I am on my way to get my vaccine.
Very.
And I'll get the vaccine as well too.
That's great, thank you. Real quickly before I move over to Dr. Gravitt, we have a question from Melissa Vaughn, I believe is how you say her name. She asks, where can folks go who don't have primary care physicians to get the vaccine? Would anybody like to chime in on that one?
So I'll go if that's okay. So it really depends on the tier, and I don't know if you want to go into that now or if you want to kind of revisit when it's my turn, but depending on the tier will indicate whether your availability, whether you're a candidate to get a shot at that particular time. And then, there's community-based locations such as CVS and Walgreens for the community, and for healthcare providers or frontline workers, there's VDH locations that you can go to get the shot.
Wonderful, thank you. Yeah, we'll revisit that when we talk a little more with you in a little bit. Thanks. So then Dr. Gravitt, how does vaccination? Well, first, could you define chain of infection for us and then explain how vaccination leads to breaking that chain of infection?
Absolutely. So chain of infection is probably not something that you really think that much about, but I think it's really vital to the entire way that we think about how people get infected, some of the mitigation strategies that we've been using throughout this pandemic, and also how does the vaccine fit into that. So the first part of that chain is, where is the virus hanging out? So this being the vector is COVID-19. And when we think about where is it hiding out, it's hiding out in humans or on surfaces, those areas. The next part of the chain is, how is it getting transmitted to another human? And so that's going to be through your respiratory droplets, speaking, those kind of things, that then allows the next person to be able to get exposed to that virus. It's intaked and then it's allowed to propagate. So how does that all fit into what vaccines are doing? Vaccines actually will protect more individuals from ever getting infected. And what that means is that if you have less people that can get infected, then less people can be vectors. So they don't have as many places to go hide out, if that makes sense. And we're going to continue to use those same mitigation strategies that we have been using to also help with the chain of infection. So whether that be social distancing, so if you're around less people, there's going to be less people to potentially infect. And then also masking, because masking is going to prevent those respiratory droplets from being exposed to other individuals. So I think all of these are very important in helping stop the virus in its tracks.
So just to make sure I'm understanding, if with the chain of infection, if I have the vaccine, then I can't spread the virus. I can't be a host any longer.
Exactly. You're going to be much less likely to able to acquire the virus, and therefore you're not going to be a host. And so if it has less places for it to go live, it's eventually going to die out over time. But you have to have a certain number of people that actually are able to do that before it really makes an impact overall.
Absolutely. And that would be herd immunity, correct?
Yes, that is correct.
How many people would you say do we need to get the vaccine in order to reach that?
Well, that is a tricky question, and I have yet to find a single person, including Dr. Fauci, that tells us exactly how much. But we're looking at, if possible, somewhere between 75 to 80% of individuals with having immunity before we're really going to be able to achieve that. But I will say that that's a moving target, and that's one of those things we don't really know because this virus is new. I mean, we're only a year in here, so we only know about a year's worth of data. So.
Yeah, absolutely. So you touched on this a little bit, but could you explain a little further how and why it's still important for us to follow the safety procedures that we've hopefully been following for several months now, even after you get your vaccine?
Right. So as Dr. Van Tassel kind of already alluded to, is that you're not going to get immunity as soon as you get that shot. I know with what's been going on for the last year or so, everybody's going to feel like, I got the shot, I'm out, I'm ready to hug people, but you're not there yet. And that's exactly right. It's really not until after that second dose that you're going to be fully immunized, and a week out from that second dose even. So in between that time, you still could potentially get exposed to the virus and potentially then lead that chain to other people. So that goes back to the importance of masking and then the importance of social distancing as well. So I think that, and the other piece of this is, it's not like a thing that we have where we can readily tell who's been infected, who's not, who's been vaccinated, who's not. So how do you know? And this goes back to the same principle that we use with any kind of infectious disease, which is universal precautions, which means we treat everybody as if you're infected until proven otherwise. So we just need to be safe about this in the meantime.
Yeah, absolutely. Will people experience side effects? And I guess what is happening exactly when someone does experience side effects?
So specifically with the side effects of the vaccines are really not that different compared to other vaccines that are currently on the market. So some of the things that people are experiencing include injection site pain, and I'm sure anybody who's ever had a vaccine can kind of attest to that. I have received my vaccine. I got the Moderna vaccine back on the 29th, being in that first wave of healthcare providers. And I definitely had a sore arm. I think it was a little bit more sore than what I would say my standard flu shot, but nothing too bad. I was able to run the next day. Everything was fine. So I think that was good. So some of the other side effects that people are seeing that you might not necessarily think of are fever, malaise, just being a little tired, muscle aches, joint pains. And some people are also experiencing where they have swollen lymph nodes, especially in that same arm in which they've received the injection. Now, all of these, however, are mild in nature, not really like the incidence of severe requiring hospitalization side effects for either of these vaccines was non-existent. So really, it's very mild, self-limiting within about 24 to 48 hours when we're looking at the side effects for either vaccine.
That's helpful. That's helpful. Thank you. And one little follow-up question to that. What are the differences between allergic reactions and side effects? Or I guess, are there differences, and what would you say they are?
Absolutely. There is a difference between an allergic reaction and a side effect. And I actually talked with a former classmate of mine about this, and that they said, hey, like, I know somebody who got the injection and they got swollen lymph nodes and it's an allergic reaction. Should they get the second dose? And I was like, that's actually a side effect. So I think it's really important to think about what is a side effect versus an allergic reaction. An allergic reaction, the one that we're most concerned about, is anaphylaxis. And so that would be swelling of the mouth, throat area, which would prohibit breathing and that kind of thing. So that's like the most severe reaction that we're really thinking about. The incidence of that has been mainly seen with the Pfizer vaccine and extremely, extremely rare. I cannot get across how, and all of the doses that have been given, if you look at the percentage, it's hardly able to give a percentage of how frequent that is. So it's really important to understand that if you're going to get some of these side effects, realize that yes, they may occur, but that should not prohibit you from getting that second dose. One thing to note too, as far as with the side effects, there does seem to be a difference in age groups. And Dr. Zimmerman kind of alluded to this, is the added benefit of being older is they're actually experiencing less side effects of this vaccine compared to our younger cohorts. We don't really understand why that is the case, but that's just one thing to note. It seems like younger patients are having more side effects compared to our older population. The other thing is, it does seem to be more prevalent that people experience side effects with their second dose versus their first dose. So that's just something else I think to just be aware of, and know when you're getting that second dose, if something is happening that didn't happen with the first dose, it doesn't mean that anything's going wrong. Again, it should be self-limiting and it should go away after that.
That is really good to know. Thank you for sharing that. Real quickly, we're going to take another question from our audience before we move on to Dr. Harrison. Reagan Gifford asks, due to the novel nature of the mRNA vaccine, are there any long-term or future concerns or health effects that might arise for people who have received the vaccine that might not develop for several years? Would you like to take that one?
I will try, and then we can have others chime in on their thoughts with this. I think that most of the time when you're looking at vaccines in general, you think about more immediate type of side effects. There is a couple of very rare side effects that can occur to vaccines. Guillain-Barré syndrome is one that has more long-standing effects that you can think about. But in general with vaccines, we think about more short-term side effects, not long-term side effects. Both of these vaccines have shown to be very safe and efficacious in large number of people. I mean, if you look at combined with these two studies, how many people were included in them? Probably larger than any other clinical trial that's out there. I mean, it's really unheard of when you're looking at clinical trials, the number of people that they've looked at. So yes, short term, I can say that it's definitely safe and effective. Long term, I just don't think that a lot of those concerns are there, because that's really not typical for the type of technology that's going on with this, and also typical to vaccines as well. One thing I do want the public to know is that all of these studies are going to be monitoring all the patients included in the studies for up to 2 years. And even beyond that, there are safeguards within our society. So the vaccine adverse effects reporting system, where anytime someone has an adverse reaction to a vaccine, that it gets reported. And so we're going to be monitoring all of that all along the way very closely. So if there needs to be any changes made, then we can do that. But I don't really foresee that being a huge issue.
Madeline, if you don't mind, just to follow up on that question about the long-term safety of this, to echo what Dr. Gravett said, first of all, we haven't done the long-term test to know. So part of that will be determined over time. However, there is a lot of room for optimism about this. And I would say that the biggest reason for optimism is that with these vaccines, we're injecting that mRNA sequence, and that mRNA sequence provides a biological response right away. But then the mRNA is gone. It's not that the mRNA is hanging around for years and years and years to provide that immunity. The point of the vaccine is to provide that burst of exposure where there's a lot of that protein made so the body's immune system can be trained to recognize it. And long after that mRNA sequence has been degraded and is gone, is completely gone from your body, the memory remains. So it's that memory that gives the immunization. So if there were going to be a severe unknown side effect, we would expect that to occur while the vaccine is still in your body. Within a few weeks after vaccination, the vaccine is gone. And all that you have left is that residual memory or immunization, which is why we're so optimistic that there shouldn't be these long-term concerns.
Thank you for sharing that. That is really good to know that it's the vaccine, once you're vaccinated, it disappears. That's what you're saying, right? You're left with the immunization, but the actual what's injected into your body goes away. Yeah, that is good to know. We have one more question and then we'll move on to Dr. Harrison's questions. Martha Gurdon asked, a friend of hers has been diagnosed with Graves' disease and is worried that her autoimmune disease will prohibit her from getting the vaccine. What should she tell her?
So the recommendation right now from the CDC is patients with autoimmune disorders are definitely at a higher risk for developing COVID and severe COVID, just because of their underlying condition. And the CDC recommends for those individuals to most definitely get the vaccine. And actually, even in the trials, those individuals, now I'm going to say autoimmune disorders in general, they were included as long as they weren't taking certain types of medications. So I definitely think that that's probably a discussion to have with your primary care physician, depending on where they are in the sequence of their medication regimens. But in general, patients with autoimmune disorders should absolutely get this vaccine because it's going to be protecting them from severe COVID, because they're at some of the highest risk for developing severe COVID.
That's good to know. Thank you. Dr. Harrison, last but not least, I have a few questions for you. What is the process for getting the vaccine? You started to touch on this a little earlier. Would you elaborate more on that for us?
Sure. So there's 3 different phases that have really been outlined by the Center for Disease Control and Prevention, and that's been adopted by the Virginia Department of Health, or VDH. The 3 phases, they go by 1A, 1B, and 1C. It's kind of important to kind of understand the concept of these phases, because that's really going to dictate when you're a candidate to take it, as we were talking about before. So 1A, just as a generalization, and if you go on the VDH site, it has all the different professions and populations and things like that, which would take us quite some time to go through. But in summary, 1A is really the healthcare personnel as well as the residents of long-term care facilities. 1B, the second phase, is really frontline essential workers. Individuals who are 75 years of age or older, people living in correctional facilities, homeless shelters, and migrant labeled camps. 1C is essentially kind of everybody else, if you will. So, but they outline, other essential workers, people age 65 older, people 16 and up with underlying medical conditions, and it kind of goes from there. On that site also is a really good telling you what the availability is for the different vaccines. So in 1A, we're about, half done. So for example, at VCU Health, we're about, half vaccinated and continuing on our way. And, now we're dipping into the 1B category as well. So in terms of how to get your vaccine, it really kind of depends on what category you fall in. As we mentioned earlier, if you are working for a healthcare facility that offers a vaccine, you're going to get the vaccine through there. So VCU Health, for example, offers the vaccine. They initially got the Pfizer, which was the deep freeze, as Dr. Van Tassel was talking about. And then we got the Moderna because it was a later approval for that. And, just because I love show and tell, I have the vaccines here in the hospital as we speak. So it's essentially free for everybody, but for the healthcare providers, they're going to get them at their locations, and for the long-term care facilities, again, the CDC has worked with 2 outpatient pharmacies, institutions, CVS and Walgreens, to help facilitate those type of populations.
Great, thank you. And we will link to that VDH site as well, so that people can see where they fall into the different tiers. So let's see, I guess the next question for you would be, what will the vaccine cost for each person?
Sure. So essentially free. So the Families First Coronavirus Response Act, allows every individual at some point, depending on, where they fall in the category or, their phase, to get it for free. Now, there is an administration cost for some of these locations, such as in the outpatient settings. I think it could be about $25, but a lot of insurances are covering that. So you're going to see government insurances and private insurances covering that. But worst case scenario, if you, don't have the insurance, it's an administrative fee of some sort.
That's good to know, thank you. So nearly 95% of Americans live within 5 miles of a pharmacy. What role would you say will pharmacies play in the vaccination campaign?
Well, we have some education roles, as we're seeing right here, to make sure that people are fully educated in terms of the safety profile for this particular or these particular vaccines. But beyond that, we're having, frontline responsibilities as well. So even at our hospital right here where I am, we have a pharmacy participation in multiple steps. The big and first primary step is the storage of the medication, to making sure there's a high accountability process for it. Then we are also, reconstituting these things, drawing them up, labeling them up, providing them. There is a very short time in which we can use it. It's about 6 hours from the time you draw it up. So we have to be very, very organized and have a sort of a production process for that. And then we're having the direct, administration responsibility as well, where we're actually administering the vaccine, both in hospitals and also in outpatient settings as well.
That's great. That's great. Could you tell us a little bit more about the logistical challenges of COVID-19 vaccination? I know there's been a lot of questions around, when will each phase be ready to get vaccinated? Could you share a little more?
I wish I knew all the answers. And just to kind of throw it out there, we talk about, you're supposed to be getting your 2 shots, and I'm a firm believer in that, as you should be. But there is also some literature and recommendations out there that they want to have as many people vaccinated all at one time for the first vaccine, and then we'll worry about the second vaccine down the road. So whatever way we end up going, what I will say in this current state, our rate limiting step is really getting the vaccine to the locations that we need them. They're not coming as fast as we like them, but they are coming, which is fantastic. And aside from that, the secondary logistical opportunities that we have is just really remaining organized in terms of the dating of the product. For example, when these come from a freezer type scenario and be reconstituted or defrosted, depending on the particular vaccine, we essentially go down to a very short expiration date. And again, once we start going right into the vial, it's 6 hours. So you got to really be very organized for the logistics. And believe it or not, that's been the easy part. So it hasn't been as bad as we thought. It's been very easy to work through that. We've had a lot of interest in the vaccine. Right now, it's really about getting the vaccine.
Yeah, definitely. We have one more question from the chat. Stacy Ocker-Joyce asked, this may have already been addressed, but how long will immunity from the vaccine last? Would you like to talk on that, Dr. Harrison, or anyone else?
It's a great question. The answer is so far so good. These studies, the majority of them were conducted towards the latter part of 2020. So we're still waiting to see how this plays out. As far as we know, the antibody titers, which are probably our best guess at trying to determine how long the immunity is there, the antibody titers do start to drop a little bit once you get into that, 4, 5, 6 months down the line. So we'll kind of have to stay tuned. There's a reasonable chance that we may need to have some kind of booster shot next year or once the next COVID season rolls around, but we don't quite have the answer to that.
Thank you. You said COVID season. Does that mean this could potentially look like the flu, but we just don't really know yet?
That's a great question.
Well, thank you for that answer. I believe that is all the questions we have at this time. So thank you all for being here and for sharing your expertise. Does anyone have any final piece of knowledge they want to share or anything else?
I'll also share that I did get my vaccine as well.
Maybe one last thing that came up while Dr. Harrison was talking, when there have been these concerns about the potential for delay in shipment or receipt of the vaccines between the time that you get your first vaccine dose and your second vaccine dose, and has left some folks wondering, well, should I wait until I can ensure that both doses are available? At this point, there doesn't seem to be any harm in delaying the time between your second dose. So if you get your first dose today and then your second dose isn't available in 21 days or 28 days, it's okay. Just get that second dose as soon as you can, and you should expect to receive the same level of immunity as if you had gotten those according to the normal schedule. So while the delays may be frustrating, it's not going to reduce the benefit of the vaccine to have a little bit of a wider window between those two doses. So please, we encourage everyone to go ahead and get your first dose as soon as you can.
I also would like to add just a couple comments there. I think for the public, I think it's fair and it's quite acceptable to be skeptical. I think nobody will punish you for that. I think the nature of the vaccine and the process we use to develop the vaccine clearly make you raise your eyebrows. I mean, that is phenomenal. I mean, when you look at clinical trials and when we look at previous clinical trials, the length and time it took to conduct these studies and to come up with a vaccine, clearly this is nothing compared to that. But I also encourage you to be open to listen as well. So be skeptical about the study, be skeptical about the data, but I hope you can also give us some ears so you can talk to you about what concerns you might have.
Thank you for sharing that, Dr. Roman. Dr. Gravitt, do you have something to add?
Yeah, I was just going to say, I think that as each one of these next sections actually rolls out for being eligible to get the vaccine, we're going to find out more and more from the Virginia Department of Health of mass vaccination sites. So I know myself, I signed up to be a volunteer to give vaccinations to the Medical Reserve Corps. I do encourage, if you are certified to be able to give vaccines, if you're a retired nurse, if you have those skills and you're not using them right now, why not use them for the greater good? So I definitely encourage as many people as possible to think about volunteering for that. But also too, next week, I know that I'm going to be on a call where they're going to talk about how some of these mass vaccination sites are going to work. So I think we're going to hear a lot more about it. And I know everyone feels really anxious about, when's it coming? But I think just, stay tuned. They're really working on having a well thought out plan, and making sure that we have enough people to be able to provide this for our individuals is going to be huge. So
definitely. Thank you for sharing that. Do you want to mention anything about the upcoming talk you're doing with VCU alumni?
Sure. So if you want to know more, or all of a sudden after this really has stirred up more questions that you have, I'm actually doing a Q&A session about COVID vaccines with the VCU Alumni Association later this month. And so more is going to be coming out about that, and we'll make sure to also share that with you guys. I think the press release is supposed to be coming out sometime today, I want to say. So that particular talk is going to be in 2 weeks. On the 29th. So stay tuned on that.
Great, great. Thank you all again for your time, and thank you to everyone who has tuned in today. We will be answering any leftover questions as best we can, and we'll share the information about Dr. Gravitt's live later on our page. So thank you all again, and have a great weekend.